Okay, so this is just going to be a quick video to go through the Axial Skeleton Lab for you. And the reason I'm putting this video together is because when I first took anatomy, I found that it was very difficult to learn the anatomical terms for anatomy without actually learning the proper pronunciation. I feel like you need that proper pronunciation to kind of really help you make that association between the name and being able to pronounce that name properly and the actual bone or part of the bone or special feature of the bone. So I'm going to try to be as brief as I can as I go through this. I know that you all have this document here that has the each bone labeled, and I tried to organize it as best as I could to make the lab as easy and smooth and efficient for you as you walk yourself through it. So I'm going to go ahead and just walk you through again the names of most of the terms, and I'll try to point out some of the tricky features on each of these bones. So first we're going to start with the skull. The skull tends to be one of the more complicated parts of the axial skeleton. And you can see that, the 2 pages of the 7 pages of terms that you need to know for this next practical are actually just the skull. So there's quite a bit to the skull here. So when we look at the skull, first we start off with just talking about the sutures of the skull. So this is where, the bones have fused together. So we'll talk about first the coronal suture. So here's the coronal suture. There's the sagittal suture, which makes sense. And if you know the planes, coronal plane, sagittal plane, this makes it very easy to remember these sutures. So the sagittal suture here is separating the 2 parietal bones, or where the 2 parietal bones fuse. If you look back here, here's the lambdoid suture. The lambdoid suture looks like the Greek lambda, so that makes that suture a little bit more easy if you know the Greek lambda. Here you'll see the squamous suture. Again, here where the parietal bone and the temporal bone are going to fuse. So that's the squamous suture. And then you can also see the coronal suture again here. So those are the sutures that you are going to be responsible for. Again, sagittal suture, coronal suture, lambdoid suture, again, sagittal suture again here. And then the squamous suture. So then when you look at the actual cranial bones, there's 8 cranial bones, 1 frontal bone, 2 parietal bones, 2 temporal bones, the occipital bone, and then the 2 that most students forget are the sphenoid bone and the ethmoid bone. So we'll go through each of these bones. Again, the frontal bone, pretty easy to identify here. The 2 parietal bones on each side here. 2 temporal bones on each side. So here's 1 temporal bone, 1 on the other side. And then you have the occipital bone back here in the posterior. And then you can actually see both parietal bones here as well. So for the sphenoid bone and the ethmoid bone, I used the image from your textbook so that you could see the outline of this bone in this skull. So you can kind of depict them here. And then you'll see that we actually have like a separate sphenoid bone that was from like a blasted skull. And then you actually have the ethmoid bone as well. So we'll get to that here shortly. So the sphenoid bone is here in green. It kind of looks like a butterfly. And then here's the ethmoid bone here in red. So those are the cranial bones. So what we're going to do now is go through each of the cranial bones, and we'll talk about the special features of the bones that you'll need to know. So for the frontal bone, here's the frontal bone again. You're going to need to know the supraorbital margin. You can kind of picture this being kind of like the eyebrows, right? So there's the supraorbital margin. And there'll just be these kind of protrusions right here, right above the eyes. There's the sinuses are difficult because you can't see all of the sinuses except for in some of the blasted parts of the skull where we took out the sphenoid bone and the ethmoid bone. So here I'm just showing you where the frontal sinus would be. So here would be the frontal sinus. For the next, and that's all you have to know for the frontal bone was just the supraorbital march and then the frontal sinus. For the parietal bone, I went ahead and used the infant skull since you've seen it already on the adult skull. So I'm going to show you here on the infant skull. Here's the parietal bones. And then you don't have to know any special features for the parietal bones. The temporal bone is the next bone. So the temporal bone is going to be this bone here. And again, you have it's hard to see here, but the squamous suture that outlines the temporal bone and shows where it fuses to the parietal bones. So for the temporal bone, features that you need to know. External auditory meatus here, pretty obvious. Mastoid process. And the styloid process that looks like a stylus here. One of the toughest features of the temporal bone is what's called the zygomatic process of the temporal bone. So I'm going to kind of take a quick brief aside here to talk about the zygomatic arch as a whole. The zygomatic arch as a whole is actually made up of two separate bones that again fuse together. And the point to depict where they are fused together, we call this the zygomaticotemporal suture, which is right here. And so I drew that in yellow for you. So the zygomatic arch is actually made up of both the temporal bone and the zygomatic bone. And so each of these bones has a process that sticks out to fuse with the other process to form that zygomatic arch. So here we're going to call this process the zygomatic process of the temporal bone because it's going to fuse. So the name before that process is going to be the bone that it's going to fuse with. So here on the temporal bone, we call it the zygomatic process of the temporal bone because it's going to fuse with the zygomatic bone. When we get to the zygomatic bone, you'll see we call this the temporal process of the zygomatic bone because it's going to fuse with the temporal bone. So that's what it's confusing only because the zygomatic arch is actually put together from two bones, from the fusion of two bones. So again, here we have the zygomatic process of the temporal bone here. Then you'll also need to know the stylomastoid foramen. Now, the foramens are, I understand, very difficult to see from here, and I actually put together a completely separate video for you of just the foramens. I find that it's really hard to learn the foramens, for me at least, individually. So I like to go through all of the foramens and where they are in association to each other. Hopefully that will help you to kind of better learn those foramens. I think they are difficult to go, again, individually. So we're going to go through them here, and I'll show you where they are here, but please do watch that video that I have on the foramina. Sorry, not foramens, foramina. So here we have it's tough to see here, the stylomastoid foramen. I'm actually going to squeeze through this next. Here you can see on this next slide, it's not depicted here, and I don't know why we didn't. But here, if you look, here's the styloid process that's sticking out that looks like a stylus. And here's the mastoid process. So in between those two is the stylomastoid foramen right here, stylomastoid foramen. So again, very difficult to see here, but the stylomastoid foramen here. And that's just going to be for the facial nerve runs through there. Then we do have the carotid foramen and then the jugular foramen. Again, carotid will be on the inferior side. It will be closer to more anterior, and then just posterior of the carotid foramen will be the jugular foramen. Again, these will be much easier to see in the video where I go through the foramina. So again, we've got the carotid foramen for the internal carotid artery, and then the jugular foramen just behind it for the internal jugular vein. And then a few other nerves go through that. The mandibular fossa is another feature you'll need to know. On this skull, they actually put a little piece of like silicone there because it was articulating with the mandible. So hence the name mandibular fossa. It will articulate with the mandibular condyle. And we'll talk about that in just a minute. So again, you can go back and look at some of the other features here, the mastoid process, the styloid process, the stylomastoid foramen. Again, you can review the carotid foramen here. You can actually see it a little better, carotid foramen, jugular foramen here. So those are all a little bit easier to see, actually, I think, in this image. And then here, I think the last feature you need to know is the internal auditory meatus. This is kind of an odd view because you're just looking at kind of the left side of looking into the interior of the skull here. So there's the internal auditory meatus. You can see the jugular foramen, and there would be the internal auditory meatus. You would have one over here on this side as well. And then that was it. So those are all the features that you would need to know for the temporal bone. So then let's get into the occipital bone. So for the occipital bone, you're going to need to know the foramen magnum. Magnum, again, is the magnificent large foramen of the skull. It's the largest foramen of the skull. Then you'll have the occipital condyles. The occipital condyles we'll talk about in terms of articulating with the atlas vertebra, which is C1. So we'll kind of come back to those. You'll also need to know the hypoglossal foramen. The hypoglossal foramen's a little bit, again, tricky. I go through this on the foramina video, but the hole above it usually is what we use to when we put together the skull on an articulated skeleton. So that's usually where we screw it in. So it's actually just below that. There's a little fossa right below there, and that would be where the hypoglossal foramen would be. So that's, you can call it the hypoglossal foramen or the hypoglossal canal. Either one would be accepted for the practical. So those are all the features for the occipital bone. So now we have the sphenoid bone here. So again, this is from a blasted skull where they took out the sphenoid bone, and you can really see that it has this nice kind of butterfly shape here. So features that you need to know for the sphenoid bone: the greater wing. So again, it looks like kind of the big wings of a butterfly. Then the lesser wings here. So the lesser wing. The optic foramen, where the optic nerve will run through. So optic foramen, optic foramen. It's the small hole here, not this large fissure, but the small one. This is going to be the superior orbital fissure here. And that superior orbital fissure has a bunch of, again, different nerves that are going to run through there. And then you also have the foramen rotundum. So optic foramen, superior orbital fissure here, and then the foramen rotundum. Here you'll also see on the superior view here, you'll see that what's called the sella turcica, or what we also call it, the sella turcica stands for the Turkish saddle. And so it looks like a saddle here. And that sella turcica is going to actually house the pituitary gland. And then we have what's called the foramen ovale. You'll hear both pronunciations. It's more commonly pronounced the foramen ovale, but if you are talking to someone from the UK or in Europe, a lot of times they'll say foramen ovale. So you'll hear both foramen ovale, foramen ovale. But I like actually the pronunciation foramen ovale because it'll help you to remember that there is an E on the end of it. So if you learn it that way, again, it just makes it a little bit easier for you to remember actually how to spell it. So again, we've got, again, Turkish saddle, sella turcica, and then we have the foramen ovale. If you flip it over and look from an inferior view on the underside of the sphenoid bone, so far we've just been looking at this kind of superior anterior view. And so if you were to flip it over and look on the inferior side, you could actually see the sphenoid sinus. So that's just these kind of big air-filled spaces right here. So now let's do the last bone here, which would be the ethmoid bone. And the ethmoid bone, you have to know just a few features here. So you've got the crista galli. The crista galli is actually the point of attachment for the falx cerebri. And the falx cerebri is just a membrane that separates the two sides of the brain. So you'll get to that a little bit later in it's part of the dura mater. So you'll get to that a little later in lecture. So again, that's the importance of the crista galli. So we've got crista galli, then we have the cribriform plate. The cribriform plate is actually a bunch of holes where the olfactory nerves will run through. So cribriform plate here. And again, this is a superior view looking down onto it. Perpendicular plate, you can actually see better from the inferior view, but you can see a little bit of that perpendicular plate sticking out here. That perpendicular plate we'll come back and talk about in a minute when we look at the skull all together. And that perpendicular plate will actually fuse with the vomer to make up your nasal septum. So that's the importance of that perpendicular plate. So there's perpendicular plate. The ethmoid sinus, so you can see the ethmoid sinuses here are going to be these kind of big air filled spaces here. So ethmoid sinus. And then middle nasal concha, or conchae is the plural. So middle nasal concha here is going to be part of the ethmoid bone. And again, you'll see that on the, I'll point these out again on the skull, and we're looking at it from an anterior view. And you can see these are going to these bones will stick down into, or this feature of this bone will stick down into the nasal cavity. And they'll be important in terms of when you get to the respiratory system. So now that we've done the bones, the cranial bones, we're going to go ahead and finish off the skull with the 14 facial bones. This will include 2 nasal bones, 2 maxilla, 2 zygomatic bones, the mandible, 2 lacrimal bones, 2 palatine bones, 2 inferior nasal conchae, and the vomer. I know this word is, unfortunately, the pronunciation of this does not actually help with the spelling. So to the inferior nasal conchae, it's pronounced conchae, but I know that doesn't help. A lot of students remember it as conchi, but just so you know, it is pronounced conchae if you end up, you're in the medical world and you hear nasal conchae and you're like, what are those? I learned it as nasal concha, but it is nasal conchae. That's the correct pronunciation for it. So let's go ahead and go through these facial bones. So let's go through the vomer here first. So here, this bone is the vomer. And if you looked right up here, you can actually see there's a tiny little suture. And that suture is where the vomer here meets the perpendicular plate of the ethmoid bone. So here's all the vomer. And then this little portion up here is actually the perpendicular plate of the ethmoid bone. So those 2 bones are going to make up the nasal septum. Nasal bones. So if you look up here, the nasal bones are just going to be these 2 short bones up top here. So your nasal bones. Maxilla. So there's a few features that you do need to know for the maxilla, which is what we kind of call the upper jaw. You need to know what's called the palatine process. I know this is where this gets confusing, but typically if we have a process, we name it after the bone that it's going to fuse with. So back here, and I have this outlined a little better in a minute when we actually look at the palatine bone, but the palatine process is actually going to fuse with the palatine bone. So that's hence why we call it the palatine process, because it's fusing. It's this process of the maxilla that's going to fuse with the palatine bone. So there's the palatine process of the maxilla. Again, you'll have the maxillary sinus, really not depicted well unless you look at a blasted skull. So here would be where your maxillary sinus would be, maybe these air-filled cavities. Alveolar processes. So here's the alveolar processes. Again, these will be these processes that will house kind of the root of your teeth. So here's the alveolar processes right up here. So that was it for the maxilla. And again, this is all part of the maxilla up here. Again, you can think of it as your upper jaw. Palatine bone. So the palatine bone, again, is going to be this bone right behind the palatine process of the maxilla. So it's going to fuse, the palatine bone actually fuses and forms a suture here with the maxilla. So here I tried to outline as best as I could in yellow. This back here will be the palatine bone here. Then we have the zygomatic bone. So here, all this is your zygomatic bone. And the zygomatic bone, of course, is going to have that temporal process of the zygomatic bone. Again, because it's going to fuse with, we named that process after what bone it's going to fuse with. So temporal process of the zygomatic bone is going to fuse with the zygomatic process of the temporal bone to form that zygomatic arch. Here's your lacrimal bone. I know it's sometimes difficult to identify a lacrimal bone, especially on a skull that isn't colored, where the bone, each bone is a different color. So the easiest way to identify the lacrimal bone is to look for the lacrimal fossa here. And the lacrimal fossa will help you to identify the lacrimal bone. Then when we look here, the inferior nasal concha, or conchae, are actually, conchae being the plural, are actually their own separate bones. So here is one of the inferior nasal concha, and then here is another one on this side. So those are your inferior nasal conchae. A little bit confusing because if you look here, the middle nasal conchae are part of, if you remember, the ethmoid bone. So they're a feature of the ethmoid bone. But the inferior nasal conchae are actually their own separate bones. So inferior nasal conchae. Mandible. Mandible has lots of different processes, and rightfully so. It's a lot of muscle attachment, right? For your jaw, your lower jaw to be able to move. So lots of, and that's why we learn a lot of these features for the points of attachment for muscles. So let's go through these real quick. There's the alveolar processes here that will help house the teeth. So alveolar processes down here. Ramus. Ramus is going to be this big flat portion of the jawbone here, of the mandible. So there's the ramus. You need to know the condylar process, which is actually going to articulate with the mandibular fossa. So you can call this the condylar process, or maybe you want to call it the mandibular condyle, whichever one is easier for you to remember. Either can be used for the practical. So there's the condylar process or mandibular condyles. Coronoid process. The nice part here is if you just help you kind of learn some of the other terms, because you're going to see we're going to use coronoid elsewhere, the word coronoid. So coronoid means beak-like. So a coronoid process is going to be beak-like. So here's your coronoid process. We have the mental foramen. This foramen is going to be an important dental landmark, hence why we learn it. So mental foramen. Then we have the mandibular foramen on the back side of the mandible. So you'll have a mandibular foramen or mandibular foramina, one on each side. Same with the mental foramina, one on each side. Again, important dental landmark. And then, of course, you can see the condylar process here, as well as the coronoid process again here. Ossicles. So again, these are going to be the bones that are located within the middle ear. I always teach my students MIS, if you can remember MIS, M-I-S. That's the order in which the ossicles will be found inside the inner ear. So there's the malleus, the incus, and the stapes. And the stapes is going to be the smallest. It's going to be the one that looks like a stirrup. Malleus kind of looks like a mallet. Incus is supposed to kind of look like an anvil. But I think the easiest to identify right away is the stapes. It looks like the stirrup. It looks like a stirrup, and it's also the smallest. The stapes is actually the smallest bone in the human body. Then we have for the fetal skull, you do need to be able to identify the bones on the fetal skull. So especially the cranial bones like the frontal bone, the parietal bones. I'll show you the temporal bones and the occipital bone in just a minute. But you also need to identify the fontanelles. For some reason, some students really get confused on this one. You're only going to see the fontanelles in a fetal skull, right? Because they fuse shortly after birth. So, and the anterior fontanelle, which is seen up here, is actually the last one to fuse. So this is what we oftentimes call the soft spot on an infant. So here is the anterior fontanelle. You can also, again, learn frontal fontanelle. Anterior fontanelle is definitely more commonly used. So here you're going to see, again, just to give you an idea of your bones, here's your frontal bone, here's your parietal bone, occipital bone back here, and here's temporal bone. So here, this area, again, in between the fusion, that fontanelle here is going to be called the anterolateral fontanelle. Anterolateral. So again, I like this one because it tells you it's the anterior versus the posterior one. And again, it's lateral, not medial, but lateral. So it kind of describes exactly where the fontanelle is. So anterolateral fontanelle. I also like sphenoidal fontanelle because it's right about where the sphenoid bone would be if you were looking in the interior of if you could open up the kind of cranial cavity here. So either term can be used, anterolateral fontanelle or sphenoidal fontanelle. Here, back here, is the posterolateral fontanelle. So again, this space here, just in between where all the bones are, there's going to be that little space prior to fusion. And you can also learn this as the mastoidal fontanelle. Again, really close to where the mastoid process is. So if you want, you're welcome to do either anterolateral, posterolateral fontanelle, or sphenoidal fontanelle and mastoidal fontanelle. Either one. The posterior fontanelle will not be depicted here because remember that closes very shortly after birth, and so it's not depicted on any of our models. And again, as a reminder, you can see the frontal bone, the parietal bone, temporal bone, and occipital bone on these. The hyoid bone, many of my previous students think it looks like an infant vampire mandible, but the hyoid bone is actually a bone it's a very odd bone because it's suspended. It doesn't articulate with any other bone, so it's suspended just by ligaments and muscles from the styloid process. And it's important because it supports the tongue and some of the muscles for swallowing. So there's your hyoid bone. It always seems to trip students up. For the vertebra, so remember that you're going to have 5 different types. You have the cervical, thoracic, lumbar, sacral, and coccyx. With the cervical, thoracic, and lumbar, I'm sure you remember the cervical. You can have 7 cervical vertebrae, 12 thoracic vertebra, and then 5 lumbar vertebra. Again, the easy way to remember that is breakfast, lunch, dinner. When do you eat them? If you have kids, about 7 a.m., 12 for lunch, and then 5 p.m. for dinner. So if you have kids and you eat early like that, it's easy to remember 7, 12, and 5. So again, 7 cervical vertebrae, 12 thoracic, 5 lumbar, and then you have the sacral bones that are fused. There are 5 bones that are fused together, and then the coccyx. So for all of the vertebrae, meaning the cervical, thoracic, and lumbar, for all of those vertebrae, you're going to be responsible for knowing certain structures. And then we'll go through after that each category of vertebrae, cervical, thoracic, and lumbar, have their own kind of special features that differentiate them. So first we're going to talk about all of the features that they have in common, and you'll need to know or be able to recognize all of these features on any of the cervical, thoracic, or lumbar vertebra. So here we go. All of them have the body of the vertebra. So here's the body. That's kind of the easiest portion. It's the bulk, right, of the vertebra. The transverse process sticking out on the sides here, transverse process. Spinous process sticking out, again, posterior towards the back. This is what you can if you palpate this along your spine, this is what you can feel, all those spinous processes. The pedicle. The pedicles are hard for most people. The pedicle is basically a bridge between the body and then the lamina. So all of this part here, I picture the pedicle being this kind of bridge here. So all of this here bridges the, again, body to the lamina. And so here's the lamina. All of this here is the lamina. So if you can picture what makes up this vertebral foramen here is actually the body here, and then the pedicle here, and then the lamina bones here, all fused to all these features again fused together. So again, body, pedicle here, and lamina here, if that helps. I know that's a hard feature to see. I wish you could touch the vertebra and really see this all the way around. So it's a tough one. Here you can see kind of on the underside, here's part of the pedicle here, right here. And you can see how it acts as this kind of bridge to the lamina here. So this is looking at an inferior underside view. So back to the superior view, you have what's called the superior articular facet, and it's going to articulate with the inferior articular facet of the vertebra above it. That's just above it. And then you have the vertebral foramen. The vertebral foramen is where the spinal cord will run through. Again, on the inferior view here, you can see the inferior articular facet here, and that's, of course, going to articulate with the superior articular facet of the vertebra below it. So, and again, you can see the transverse process here from the underside. You can see, of course, the body. You can see the spinous process and the vertebral foramen all from the inferior view. Between the adjacent vertebra, of course, is where you're going to find the intervertebral disc here. So again, this is just a pad of fibrocartilage that's going to be between the bodies of the adjacent vertebra. And then you're going to have what's called the intervertebral foramen here. This is going to be an opening where the spinal nerves are going to leave the spinal cord. And this opening is kind of between the pedicles of adjacent vertebra. So here you've got pedicle, here you've got pedicle. And that helps to make up that intervertebral foramen. So again, intervertebral, inter means between vertebra. So that helps you, if that helps you to remember that term, intervertebral, the between vertebra foramen. For the cervical vertebra, this is where we're going to start to go through special features. Cervical vertebra are a little bit more complex because we have the atlas and the axis, which kind of have their own special features. So this is going to show you some of the features that you need to know for C2 through C6. So they start with C2, which is the axis, and we'll go through the axis in just a minute. But for all of your cervical vertebra, they're all going to have one special feature that's going to differentiate them from all the other vertebra, and that is that they're going to have the transverse foramina. So, or transverse foramen being singular. The transverse foramen are only in the cervical vertebra. So if you get a vertebra, one of the first questions you want to ask yourself is, does it have a transverse foramen? Does it have a hole in the transverse process? If it does, automatically then you know it's a cervical vertebra. So hopefully that will help you out a little bit. And the reason that it has this foramen in the transverse process, this transverse foramen, is for the vertebral artery and vein to run towards the brain, to run to the brain. Also, the spinous process of the cervical vertebra is what's called bifid or bifurcated. That just means it's forked. So that's another feature of the cervical vertebra that identifies it from separate from the thoracic and the lumbar. Again, we have the atlas and the axis. The atlas is the first cervical vertebra, and it is very different than C2 through C6 in that it has this anterior arch and this posterior arch. The anterior arch is going to replace the body and the pedicle. So that's why we have the anterior arch here, and then we have the posterior arch here. The posterior arch is going to replace the lamina and the spinous process, and the anterior arch here is going to replace the body and the pedicle. So again, just slightly different features than you're going to see on the rest of the cervical vertebra. The atlas is going to, of course, be your first cervical vertebra. So it's important to remember that it has these superior articular facets. Those superior articular facets are actually going to articulate with the occipital condyles of the occipital bone on the skull. And this is what's going to allow you to do that yes motion, that shaking your head up and down yes motion with your head. So again, superior articular facets going to articulate with the occipital condyles of the skull. Hopefully that helps you kind of put them all together in an articulated skeleton. Again, of course, they're going to have that transverse foramen. It is a cervical vertebra, so it will have that transverse foramen. Axis will be your cervical vertebra number 2, and the axis is going to have this big, this kind of protruding portion of the bone called the dens. You can also call it the odontoid process, but probably easier to remember the dens. So the dens here is actually going to articulate with the anterior arch of the atlas here. So it provides a pivot point for the atlas. So if you can picture, if you put the atlas here on the dens, then this is what allows you to shake your head as you move the atlas back and forth, allows you to shake your head no. So atlas here, the joint that's formed between here, the superior articular facet and the occipital condyles, allows you to do the yes motion with your head. And here, where the dens is, again, kind of pivoting back and forth in the anterior arch of the atlas, this allows you to do the no motion with your head. So hopefully that helps you to kind of remember some of those parts. And then, of course, they label all of the superior articular facet, what would be kind of more the body, really hard to see on the axis, the pedicle, the bifid spinous process here, and then the lamina, little small transverse processes here. So again, you can kind of see some of those features there. And you can see that a little bit better here. So let's move on to, so there's the atlas and the axis together, so you can kind of picture, again, the atlas pivoting on the dens of the axis there. Thoracic vertebra. So for your thoracic vertebra here, again, you'll have all those features that you need to know for for all of the vertebra, but some of the things that are going to make it a little bit different. The body here obviously is going to be a bit larger than it is on the cervical vertebra. Also, the spinous process is actually much longer and it points more inferior, and it is not bifid. And I'll show you how this makes it look different from the posterior view in just a moment. And so there's that long spinous process. Also the transverse process, here you'll see no transverse foramina, so another giveaway here. Also the inferior articular facet, you can see here, just a little bit better on it's a little less obvious where to find it here on the thoracic vertebra, so that's why I pointed out here. Oops. Let's see. Some of the special features, again, that really make the thoracic vertebra different is that because the thoracic vertebra are going to articulate with the ribs, you're going to have these special features that you have where they articulate. So the demifacets are going to be on the body, and there'll be a superior one and an inferior one. You just call them demifacets. And this is going to be where you're going to articulate with the head of the ribs. So those are your demifacets. Also, the rib is going to articulate here. This is called the articular facet for the tubercle of the rib. And this articular facet, again, we'll go through the rib in just a minute, but this is where the tubercle of the rib is going to hit on that transverse process. So again, the two kind of articulating points that you need to know on the thoracic vertebra where the ribs are going to articulate are the demifacets and the articular facet for the tubercle of the rib. And then I'll give you kind of my special hint in just a minute with the thoracic vertebra and identifying it from a lumbar vertebra. So lastly here, we're going to go through the lumbar vertebra before we go through sacrum and coccyx. Again, remember that there are 12 thoracic vertebrae, and then there are 5 lumbar vertebrae. Some of the differentiating features, the body, of course, is going to be very broad and heavy here in the lumbar vertebra, more so even than the thoracic vertebra. The spinous process is going to be very blunt and wide, especially in a more lateral view. And so if you compare the cervical, thoracic, lumbar vertebra, if you were given a vertebra and asked to identify which one it is, kind of the easy way to do this is, one, ask yourself, does it have a transverse foramen? If it has a transverse foramen, then you're looking at a cervical vertebra. There's the first thing. If it does not have a transverse foramen, then my easy anatomy trick that I actually picked up from students years ago is that if you look again from the posterior view, the thoracic vertebra looks like a giraffe. And here, if you look at the lumbar vertebra, it looks like a moose. So there is one way. The reason being for that is that this very pointed, inferior pointing spinous process makes it look a little more like a giraffe. And here, that very blunt, broad spinous process here makes the lumbar vertebra look more like a moose, and especially because it's got this really big, broad body as well. So there's the kind of hint. Does it have a transverse foramen? If it does, cervical vertebra. Does it look like a giraffe? Thoracic. Does it look like a moose? Lumbar. So there you go. There's the student anatomy trick. So let's go ahead and go on to the sacral vertebra. The sacrum is actually 5 bones that are fused together into one bone, and that's what makes up the sacrum. So for the sacrum, you need to know the sacral promontory. The sacral promontory is, of course, where you're going to articulate with the 5th lumbar vertebra. And then, so that's the only feature you need to know for the sacrum, other than that this is the sacrum. Okay, so this is the sacrum. And then this is a separate bone here, which is our next bone, the coccyx. The coccyx is, of course, your tailbone. And this is usually anywhere from 3 to 5 bones that have been fused together. So that, we often call it the tailbone, but for the lab practical, you do need to give its proper anatomical name, which is the coccyx. For the ribs tend to be tricky for a lot of students. So to kind of orient yourself, first I would look for the rib tubercle. Remember that rib tubercle is going to articulate, let me go back here, with this articular facet on the thoracic vertebra. So there's that rib tubercle. And then if you find the rib tubercle here, this is going to be the head end. So there's the head that's going to articulate actually with the demifaucet of the thoracic vertebra. So let me just remind you where the demifaucets are, here and here. And so we've got the head, the rib tubercle here, and then we have the sternal end. The sternal end is going to have the facet for the costal cartilage. And that costal cartilage is going to be a bit of cartilage that is actually going to connect the rib to the sternum. So let's look at that below. So here is the sternum below. And here you can see that costal cartilage that would be attached to the sternal end of the rib. And that costal cartilage would then connect to the actual sternum here. The sternum is made up of 3 bones, what's called the manubrium. This bone right here is the manubrium. Then the body of the sternum here. And then the xiphoid process, that very important landmark that we use for doing CPR to make sure that we don't break off the xiphoid process. And then we have the costal cartilage again. This is the costal cartilage. I went ahead and marked it here because this is really the only place on some of the images that we showed you that you can find it. You can see it on some of the articulated skeletons as well. So again, that costal cartilage is going to attach the ribs to the sternum. Rib groupings. So for your rib groupings, you're going to have your true ribs, rib 1 through 7. And the reason these are called the true ribs is that the costal cartilage is actually going to attach directly to the sternum. So you can see 1, 2, 3, 4, 5, 6, 7. Each of the points of the costal cartilage is going to attach directly to the sternum, from the sternal end of the rib to the actual sternum itself. Now the false ribs, ribs 8 through 10, the costal cartilage is actually going to attach, all of the costal cartilage of ribs 8 through 10 will attach to each other down here, and then will eventually come up and attach to the costal cartilage of the 7th rib. So 8 through 10, this is the costal cartilage of ribs 8 through 10 that are coming up and fusing with the costal cartilage of rib 7 before it attaches to the sternum. So that's why they're called the false ribs. So ribs 8 through 10, again, are false ribs, and then the floating ribs are ribs 11 and 12. And they're called floating because they do not attach to the sternum. They don't have the costal cartilage attaching on the anterior end to the sternum. So again, floating 11 and 12. And that is it for this. So I will do a separate video for the appendicular skeleton, and I hope that helps you in terms of being able to pronounce the terms and hopefully remember them.